Pregnancy occurs when the egg is fertilized after it has been released from the ovaries during ovulation. The fertilized egg then travels down to the uterus, where implantation occurs. A successful implantation results in pregnancy. On average, a full-term pregnancy lasts 4 weeks. There are many factors that can affect a pregnancy. Women who receive an early pregnancy diagnosis and prenatal care are more likely to experience a healthy pregnancy and give birth to a healthy baby. Knowing what to expect during the full pregnancy term is important for monitoring both of your health and the health of baby. And if you'd like to prevent pregnancy, there are also effective forms of birth control you should keep in mind. A missed period is one of the earliest symptoms of pregnancy and maybe the most classic one. However, a missed period doesn't necessarily mean you're pregnant, especially if your cycle tends to irregular. And I also experienced during my pregnancy, the symptoms are just like headaches. Headaches are common in early pregnancy. They're usually caused by altered hormone levels and increased blood volume. If you feel those hormones released during pregnancy can sometimes trap the valve between your stomach and the esophagus. When stomach acid leaks out, this can result in heartburn. Hormone change during early pregnancy can slow down your digestive system. As a result, you may become constipated. As a muscle in your uterus begin to expand or stretch, you may feel a pulling sensation that resembles menstrual cramps. If spotting or bleeding occurs alongside your cramps, it could signal a miscarriage or an ectopic pregnancy. Hormones and stress in the muscles are the biggest causes of back pain in early pregnancy. Later on, your increased weight and shifted center of gravity may add to your back pain. Around half of all pregnant women report back pain during their pregnancy. In my experience, pregnant women are at increased risk of anemia also, causing symptoms such as lightheadedness and dizziness. So experience breast change and insomnia, vomiting, hair pain, and leg cramps. Insomnia is a common symptom of early pregnancy. Stress, physical discomfort, and hormonal change can be contributing causes. Breast change are one of the first noticeable signs of pregnancy, even before you're far enough along for a positive test. Your breast may begin to feel tender, swollen, and generally heavy or full. Your nipples may become also larger or more sensitive, and the areola may tighten also. These hormones can make your skin oilier, which can clog pores. Pregnancy acne is usually temporary and clears up after your baby is born. I also experienced it. Vomiting is a common morning sickness, a common symptom that usually appears within the first 4 months. Morning sickness is often the first sign that you are pregnant. I used to despise vomiting when I was pregnant. Hip discomfort or hip pain is common in pregnancy, and it tends to get worse as the pregnancy progresses. Pressure on your ligaments, sciatica, changes in your posture, and heavier uterus are all possible causes. Diarrhea and other digestive defects occur frequently during pregnancy. Hormone fluctuations and change in nutrition or a different diet and increased stress are all possible. Furthermore, despite this fact that you have to return to the bathroom to frequently stress. It is extremely stressful. Pregnancy is usually a joyful time, but it can often be stressful. That you can comprehend yourself sometimes, that you can comprehend yourself at times, and that you're always hungry for no apparent reason. Even getting pregnant is difficult. Just be patient and follow the instructions of the midwives. Eat nutritious diet and exercise, and do pregnancy exercise and take vitamins also. So you can have a healthy baby.